In those early days, it was very strange because we weren't sure it was a virus.
The very first time I saw anything written about this, and it was a little teeny square, it said gay cancer.
I remember being on rounds as a hematology fellow at Beth Israel Hospital. There was talk about gay-related immune deficiency, which had been noted out in California.
I used to walk by AIDS Action when it was in the basement of Fenway, and I used to think, what are those people doing? Why are they wasting their time with this stuff? This disease is not going to come to Boston.
In those early days when we tried to do education or outreach in gay bars, we had a hard time getting in. People would, bar owners were not happy to see us. They thought we were bad for business. And gay patrons would often say, oh, get out of here. That's not a real issue. That's a New York thing.
Again, remember, no one really knew what caused this. No one had any concept of the dimensions of the epidemic. So I started out sort of as a volunteer at the Fenway, and then encountered Larry Kessler and Peter Lombardi and other of the founding fathers.
If it wasn't for a few very dedicated gay men and lesbian women in the early years, we wouldn't have gotten where we are today.
The AIDS Action Committee was founded in 1983 by a small group of volunteers. At that time, people with AIDS were routinely evicted from their homes, shunned by the healthcare community, and generally treated as lepers once were. AIDS Action's early volunteers responded to that hysterical atmosphere with a spirit of respect, compassion, empowerment, and love that can only be called heroic.
It was a hot political issue. It was a controversial issue in terms of the nature of transmission around drug use, around sex, and around gay sex.
One of the first stories I did at Channel 4 focusing on AIDS had to do with information that I learned out of City Hall, what was being done to plan for this coming epidemic. And there was a lot of discussion in the newsroom that afternoon, late in the afternoon, because we were going to lead with the story. And there was a lot of talk about whether we should call it an epidemic or whether that was being reactionary.
Clearly, the government at the time was very, very slow in coming to grips with this. There were many rationalizations put forth. It was a rare medical illness. It was occurring on the fringes of society. It could be related to drug abuse and, quote, self-inflicted. There was clearly a overlay of homophobia and dislike.
The gay community here in Boston is insisting that the pressure will continue until our government begins treating AIDS as a serious disease. Why do you think the government has been slow to appropriate funds?
Well, because the straight people haven't been affected.
When the government failed to respond to the mounting crisis, people with AIDS and their supporters took to the streets. AIDS Action's early clients practiced another kind of activism. Refusing to see themselves as victims, they took control of their lives in a way that helped define the agency's approach to client services.
Individual patients began to tell us what they wanted or what they found offensive or what they wouldn't tolerate. Among our very earliest clients at AIDS Action were 3 or 4 men who were very wise. In a sense, they were actually early models of this living with AIDS posture that we now take for granted.
AIDS Action's early volunteers set an example of sensitivity and decency that enabled healthcare workers and others to overcome their irrational fears and break down their prejudices toward people with AIDS. Part of that effort involved creating an organization that would reflect the diversity of cultures and communities affected by AIDS.
When our buddies went into the hospital rooms to visit, or even our staff, and sat on the bed or shook the hands of people with AIDS, helped feed them, or take them for walks up and down the corridor or outside onto the solarium or whatever, nurses would sort of stand back and look at that and say, if these lay people can do this, if these non-professionals can do it, we ought to be able to do this.
The efforts of those appealing for calm and compassion were often threatened by others who hoped to fan the flames of hysteria. Patrick Buchanan suggested that AIDS was nature's retribution against homosexuals, while nationally syndicated columnist William F. Buckley proposed identifying people with AIDS by forcibly tattooing them.
The early days were very difficult. In 1985, when I tested positive, people weren't talking about this disease. People, if they were doing anything, they were destroying people's lives. They were telling Ryan White he couldn't go to school. They were so anti-AIDS and anti-gay that the thought of revealing this, or even thinking it could be true, was overwhelming.
I have a lot of friends who have been very close and are always there, and some others who have seemed to just, you know, take off from the scene. There are times when I let it get to me, and it you know, but, and it hurt, you know, and it's very alienating. But I do have a close set of friends who are always there, and the AIDS committee in town has been very supportive to me. So, and I've had a lover of many years, and we live together, and he's right there all the time. So things have been good for me.
We had gay men whose friends stopped calling, stopped coming over, and they stopped inviting them, and they all of a sudden were very isolated. We had men who were literally thrown out of their homes, you know, and gave them 1 hour's notice to get out. And sometimes they didn't give them any notice. They came home and all their stuff was packed up and sitting on the porch or on the curb. And eventually what emerged was the mission, which is one that we've continued to have, and that was to advocate for those people who were sick. Secondly was to offer them support, trying to figure out what services they might need. And thirdly, to educate. The major component of the education at the very beginning was to establish a hotline.
AIDS Action's hotline represented one of the organization's earliest efforts to educate the public about HIV transmission and prevention. In October of 1985, those efforts would increase suddenly and dramatically.
Good evening. The Hollywood community, motion picture, and television lovers around the world tonight are mourning the death of Rock Hudson, dead at the age of 59.
Even though more than 7,000 Americans had already died from the disease, it was the death of Rock Hudson that helped force the nation to finally confront the reality of the AIDS epidemic.
When Rock Hudson got AIDS, and there was suddenly stories about Rock Hudson on the front of Time magazine and Newsweek and everywhere you looked, there was almost a, like, well, okay, already. You know, finally, someone will take this more seriously. There was a real momentum there. People were suddenly more willing to listen.
However, it appears that the initial enthusiasm for the experimental drug that Rock Hudson took, HPA-23, is waning. Doctors point to the fact that there have been no papers on this drug published for over a year now. In the medical community, this is seen as a sign that the drug has little or no potential.
Okay, Jean, thank you very much. This afternoon in Boston, the local AIDS Action Committee credited Hudson with bringing more attention to the problem of AIDS by turning a statistic into a real person.
What's disturbing, however, is the fact that, 20 other people died today, in addition to Rock Hudson, and 40 others were diagnosed around the country. And we can't forget them or have them overshadowed by one celebrity.
In helping the public deal with issues surrounding Hudson's death, AIDS Action continued in its role as a reliable and trusted resource for local health officials and the public. That experience included assisting officials in addressing the possible contamination of the area's blood supply.
AIDS Action Committee provided a resource and speakers to Red Cross Blood Center staff. We needed to educate our nurses, our donor recruiters, about the facts.
We found that there were some individuals who were men who didn't self-identify as gay, but who had sex with men who were donating blood.
Our nurses weren't used to asking questions about sexual behavior. This was a whole new thing for them that they needed to learn and understand why it was so important. And AIDS Action Committee representatives and spokespersons were very effective in dramatically getting points across to our staff that they remembered.
We know AIDS as a disease that is relentless in its course. It is disdainful of age, attacking both the very old and the very young, and it spitefully remains a mystery.
Even though the nation's public health professionals had finally begun to deal with the epidemic, the Reagan administration's response continued to border on criminal negligence.
As the president said last night, the federal government will soon require testing for prisoners, immigrants, and aliens seeking permanent residence. Free speech, that's what it's all about.
What do we need? Money for aid! When do we need it? Now!
The loudest protest was outside the conference. Larry Kessler from the AIDS Action Committee were among a couple of hundred demonstrators who went to the White House to protest what they say is Reagan's lack of action with AIDS problems.
I don't mind a politician saying no as long as we've first had an informed discussion about it and they can give me good reasons for their saying no. But simply saying no because I don't want to deal with it or I can't deal with it, you know, it was similar to Governor Dukakis a couple of years ago saying when he was governor, I don't care if you even prove that needle exchange works, the answer is no. Well, that's not leadership. That's a Neanderthal position, you know, of keeping their head in the sand at all costs. Well, the costs here are too high.
Closer to home, AIDS Action was confronting pervasive homophobia at the state level. In the fall of 1987, AIDS Action was at the center of a heated debate on Beacon Hill regarding the sexually explicit nature of AIDS prevention materials for gay and bisexual men.
That was a very explicit brochure in its description, its language, and to some extent its illustration. That brochure was targeted specifically to gay men and men who were having sex with men who were not listening to the more vanilla kind of messages. And the Senate had a couple outstanding, well-known homophobes on it who went berserk, saying that state money was being used for this. Well, state money was not being used for it. But at one point, somebody said you should take all their money away, even though they didn't use any of the state money that you give them. But by giving them money, they were able to move money over into that line and therefore produce this obscene material. And I said, okay, take the money.
In the end, the politicians blinked. State funds were not denied, and AIDS Action continued its educational mission.
It was a gamble. And this is where Dukakis actually was good about it. He was very uncomfortable with the brochure, but he also knew we can't take their money away. They're feeding people, they're housing people, they're getting people off the street, they're fighting discrimination, they're training. We're not going to take that money away.
The moral issue on what kind of advertisement should be out there, just having a picture of a condom and talking about a condom is our problem. Is because we don't talk about it, is people are not using them.
The government's barriers to safer sex education eventually took their toll. By 1990, nearly 1 million Americans were infected with HIV. What had once been called the gay plague now affected every race, sex, and age group. No one was immune.
So the concept that somehow this virus discriminates with regard to whom it infects and whom it doesn't is foolish. There was a time when we wrote a report that was published in a major medical journal of a woman being infected with HIV and having AIDS. That was thought to be startling. We now, about almost 20% of the people we take care of, and we take care of over 1,000 people with HIV on an active basis, are women.
On the back of the card is the AIDS Action hotline number, and it's a youth-only hotline number too. And it's being a person that's living with HIV, you want to feel useful, you want to feel that what you're doing means something. Unless you're tested, you may not know that you have this virus. You understand what I'm saying? My work is really important to me. Sometimes it's what keeps me going, to know that I'm being a help to saving someone else's life. It's probably too late now for me to think about a cure. It's not going to happen in my lifetime. But if I could have saved some people's lives just by giving them some information that they can use, then it makes it all worthwhile.
The challenge for the AIDS Action Committee and the work that the AIDS Action Committee does is on some levels much harder. It requires a deep understanding of general human psychology, the specific cultural aspects of the groups that you're trying to help, a creative approach which catches people's attention. It's labor intensive, it's expensive, and yet the impact that those interventions have are certainly as great as anything that I or any other scientist and physician can do.
I was living in abandoned buildings. I had lost my daughter. I'd lost everything. And I thought that I was infected, and what's the use? AIDS Action's message of hope was carried with me in the streets. I had hit bottom and realized there were no more excuses, because now there was a place for me to go. Now there was a place to get help. And that saved my life.
AIDS Action's activities have evolved to reflect the changing character of the epidemic. Specific outreach and advocacy programs have been developed to meet the needs of women, communities of color, youth, and injection drug users. And volunteers continue to function as the heart and soul of the AIDS Action Committee.
Good afternoon, AIDS Action Hotline. This is Robert.
I think more often than not what we hear is fear, absolute fear, even from a chronic caller, someone who's been tested a dozen times and does not trust that test.
Okay, to have intercourse, you want to use a condom, and it has to be a latex condom.
I hear them saying, help, I'm tired of playing safe. I don't want to play safe anymore. I want to go out and do such and such, such and such, such and such. And that's when we really have to talk them down and say, the complexion of this disease hasn't changed for the better.
Boston is spoiled. I mean, Boston had this resource that created a foundation from which we could then grow. The AIDS Action Committee guided us through the years of the epidemic that we've endured so far.
Every day, the staff and volunteers of the AIDS Action Committee draw strength from the example set by those who have inspired us with their wisdom, their passion, their rage, their humor, and their humanity.
And if you know someone who gets AIDS, and that person has been in any way important or close to you, that you don't think of this person as, this is my friend who has AIDS now. You think of that person as, this is my friend.
Everybody here is the light. A lot of times we don't know what's going to work, but this is what works. Love and support, standing up together, being together.
My name is Sidney Borum, and I'm a person living with AIDS. It is that commitment and strength which I have found here today and working with those around the walk that gives me the drive.
Living with HIV disease is often a lonely and isolating experience. But someday, the AIDS pandemic will end, and when that day comes, all of us who contributed our time, our money, and our hearts will know that what we did mattered.
The people on the AIDS Action Committee, everyone here, everyone that pledged, everyone that helps in the volunteer services, and everything, that is the AIDS Action Committee.
What I did was started to connect with people who I could trust and started to tell my family and said, look, I'm not going to make it through this alone. I don't want you standing around at my funeral saying, I wished I'd known more, I wished I could have done more. Now's the time to do it. Now's the time to say it.
The work of AIDS Action is more than a series of responses to an epidemic. It is a celebration of what is most noble in the human spirit. The courage shown by AIDS Action's early clients, volunteers, and staff members provides an example that inspires thousands of people, from the companies who help make the AIDS Pledge Walk one of the country's most successful, to the 8th grader who donates his allowance to help people with AIDS. In a crisis which has come to exceed our worst nightmares, AIDS Action has shown us the good that can be accomplished when an entire community responds.
If your heart always did what a normal heart should do, if you always play a part instead of being who you really are, then you might just miss the one who's standing there. So instead of passing by, show him that you care. Instead of asking all the madness that we're taught, never questioning the rules, then we're living lives we bought so long ago. How are they to know it's not who's wrong or right, it's just another way? I don't want to fight, but no, I'm gonna stay with you till the end, with you, my friend, 'cause love don't need a reason. Love don't always rhyme, and love is all we have for now. What we don't have is time. I'll hold you close, time can't tear us apart. Forever I will stand by you. Oh, it's got to start with the beat of one heart. Together we will see this through, 'cause love don't need a reason. Love's never a crime. Love is all we have for now. What we don't have is time.